Welcome to the Gold Report, where we inspire you to be 10% more courageous in your daily life. We're so glad you're here. Please like, share, and subscribe so you never miss an episode. I'm very excited to introduce our next guest. This is Dr. Dana Granberg-Nill, an experienced family physician who has left the medical industrial complex about 3 years ago to work on a better way, a new path forward. We're going to hear from her all about what she's doing now, why she left the medical industrial complex, and what the future looks like for doctors and patients. Please welcome Dr. Dana Granberg-Nill. Welcome to the Gold Report, Dr. Granberg-Nill. It's great to have you.
Great to be here.
Excellent. So I just want to remind everybody who doesn't follow me, doesn't know this very well, how we know each other. And I hope that you jump in and then we'll talk about what you're up to these days. So I had the pleasure of meeting Dr. Granberg-Nill about a year into the COVID. Was it a 2021?
It was.
It was 2021, about a year into the COVID madness, a year and a half, I suppose, into the COVID madness. And I was immediately struck by many things. First of all, of course, she's a physician. She also had a very kind of a wise demeanor about her. And she was very frustrated with the medical industrial complex. She's working as a family physician for many, many years. And she was seeing the same problems I was seeing during the COVID years. And she got very, very frustrated. And we decided to work together. And we've been working together since 2021. And in the last few years, we've actually really turned our attention towards trying to build a better solution. Those of you who know me, you know that I like to build solutions, not to dwell on what's negative, but see what we can make and create. And so together and with other excellent physicians and allied health professionals, we've turned our attention to building goldcare.com. And I'm happy to tell everybody that Dr. Granberg-Nill is actually the top, I like to call you top dog. It's true that I'm CEO, but you are the chief operating officer of goldcare.com. And so I'd love to walk people through what exactly Goldcare is. And perhaps we can start with why you decided to make the transition from the medical industrial complex to this new way of practicing medicine.
That is, I think it can easily be explained in that I was given no choice, because at a certain point, once the curtain is lifted, so to speak, you have to decide if you want to continue in that realm of practicing medicine or not. And so when I left a practice that I had been with for 20 years, I didn't know exactly what I would be doing, but I'm so grateful that you took a chance on me a little bit, because it's not like I really had done too much with regard to building something new. I had been a physician that had been managed by a manager and, nestled in the MIC, so to speak. And I don't know how to explain it other than it really is an awakening where you look around and you realize that everything that you've done for 20 years, it wasn't just peeling off layers slowly but surely. I would be annoyed with certain IT issues, or the fact that people were paying higher and higher insurance rates and getting less and less. And so when I tried to treat patients in the manner that I thought would be best during COVID, that just was sadly a dividing line with people that I'd practiced with peacefully for 20 years. That just was not thought to be appropriate. And so moving forward with Dr. Gold, we've created a system where not only are clinicians that want to do the right thing for the right reasons, for members that also have come awake, so to speak, but it also protects the members. It's just very hard for people in the medical system currently to get truly unbiased advice. And so our main objective is to educate, I think.
Yeah. What's interesting about listening to you say that is that all physicians in the medical industrial complex, working for hospitals or corporations or insurance companies, we absolutely had a lot of frustrations over the years, and we saw the flaws in the system, and we saw really how deficient it was. Some ways corrupt, in other ways just deficient, a lot of times excessive. But I think most of us stayed until we were pushed to the point that those negatives really, really started imposing on patient care. Because just listening to you, we tolerated a lot. We tolerated IT systems that were not built for the patient or the doctor. We tolerated lower wages. We tolerated not getting paid for things. We tolerated layers and layers of bureaucracy, pharmaceutical phone calls that we shouldn't have to really manage. But we left because we were told that we couldn't do the right thing for the patients. And I think you and I together were determined to make sure that would never be the case again in what we do going forward.
It's true. Yesterday, I had the pleasure of meeting for lunch my old MA at the previous life that I lived, and just hearing that in the 3 years since I left, there's still the same ongoing issues. And frankly, I think they've escalated with regard to frustration with IT and payment and trying to see so many patients for, on a treadmill, essentially. So, it's sad, but it also it reminds me of what a blessing I had to go through what I did, because I think when you experience those afflictions, it really makes you understand. I thought maybe when I left that you would have a little bit of, we can fix this. And you said very early on, and it's always stuck with me, Dana, we can't repair the system. It's just so bloated and corrupt. We need to just do something new and have people come to that. And you saw that very early on, and I believe that that's what we're doing at Gold Care. And I do think that it's only a matter of time before there is awakening on a larger scale. Think we've been protected from rapid growth, which has been a blessing because it's given us a chance to really get everything working and moving, so that when people are ready to finally jump ship from a sinking ship, that we are there and we're ready to take them on.
Exactly. So it's true. We turned away from the medical industrial complex, and we learned pretty early that we had to rebuild it completely. There was really no component of the current system that I felt we could use. And that meant everything. And I didn't know when we started that there would really be no components that I thought were okay. But for example, things that are invisible to patients, such as the documentation system that physicians use, right? The patient doesn't think about that very often. But the documentation systems that physicians use are so onerous that it cuts into time that the doctor could be spending with the patient. And also, many of them, due to government regulations, put in questions that require the doctor to ask questions that the doctor's either not interested in or actually viscerally opposed to asking. And of course, I'm thinking about a lot of the DEI questions and the gender kind of questions. And we just made a decision at the beginning that we couldn't, do this if we're going to do this halfway. So we ended up building everything fresh, new from the ground up. And of course, this took a lot of effort. It was a big lift. But you, as its chief operating officer, could you explain to people what are some of the ways that Gold Care does things differently than the medical industrial complex? Just real practical differences.
Practical differences. Number one, we are a private membership association. So we try to take things out of the public and statutory realm as much as possible into a private membership, much like Sam's Club or Costco or that kind of thing. And what that does is it helps us to mutually agree on what's important to both of us. And that's the business that we are doing in a PMA. That PMA then translates into everything. With regard to a lot of people's frustration in the current medical system is that if they have a frustration or a dispute, so to speak, it's hard to really get that moved up the chain of command. And at Gold Care, because we are a private membership association, that dispute is handled ethically, quickly, and quite frankly, it's based biblically. So in the Bible, for example, delay of justice is not good. And so we try not to delay justice. We try to do things by in the right way. And I think that's fallen by the wayside a lot in the NYC.
Before we move on to anything else, I want to stick with the PMA just a little bit because this is a new concept for people. So private membership association is a legal status, I would say, that a company can enter into with its clients, for example. And when both sides are in the PMA, the private membership association, then you get to treat each other like members of a family. And obviously, members of a family don't sue each other, but they also, on a positive note, they get to talk to each other much more directly and without fear of outside influence than if they're not part of the family. So it's very important that all people within Gold Care are actually members of the PMA. So doctors are members of the PMA. Everyone who works at Gold Care is a member of the PMA. Patients are members of the PMA. And it enables us to act more like a family. And we've taken out, families have good and bad, right? So, sometimes you have fights with your family, right? And you have to find a way to settle those disputes, but also have affection and respect for your family members. And that's what we've done. And that's what we saw is tremendously broken in the old system. So you're right. This is one of the most exciting things about Gold Care is how we settle disputes, or it's called dispute resolution. And we're able to do that because we're a PMA. So that's a big one. And in what other ways is Gold Care different than the old system?
Well, going back to the PMA, there's a sense of privacy. We actually don't subscribe by HIPAA per se. We actually take the protection of people's private information a step farther. And so many people have probably experienced those large data breaches. I received 2 or 3 letters in the last 2 to 3 months of healthcare facilities near me where my personal health information was breached. And so in the beginning, we actually had some other things set up, and we've kind of simplified it and gone back. But our EMR being proprietary enables us to protect people in so many ways that they will never be aware of. For one, we don't subscribe currently to the eScribe. And so we work with Freedom Pharmacies and we use fax capabilities. We are always not trying to get around, but work in a broken system, always protecting our members. So that's another thing that I think may not be as obvious to members is how, because we've created our own system, we can operate in a way that we've always wanted to, but we're always prohibited from.
I love that. I'm just going to go over that a little bit. So we have enhanced privacy. So when we say that we're not compliant with HIPAA, what that means is that we have taken all the same precautions and all the same security measures that people who are compliant, or organizations that are compliant with HIPAA, but we don't allow ourselves to be subjected to HIPAA rules, which actually makes you more likely to be subject of a breach, of a security and privacy breach. So we actually built our own technology so that we couldn't really be hacked in that way, and we won't be complying with certain government steps that HIPAA requires you to comply with that actually puts your data at risk. So we've taken a lot of IT steps to make sure that you are really a completely private. And one of the biggest areas where patients can lose their privacy is with an outside pharmacy chain that then they get hacked or have some security breach issue. And we've done multiple steps to make sure that that is exceedingly unlikely to happen to any Gold Care member. So yes, enhanced privacy is a big deal to us. And just looking at it from the consumer's perspective. Let's keep going. What are other ways that are different?
I think the biggest reason is because you just have selected really good people. I never thought I would say this as a physician, but our IT department is intuitive. They work with us. They have created a product that is it's amazing what they've created. And we were told from the beginning, don't do your own EMR. That takes 10 years to develop, but not with our IT team. And they are responsive to not just me as a clinician when we're trying to work through bugs, but also to the members. And so we go that extra step. IT has special classes just to help people maneuver the platform. We select only the best pharmacists.
Wait, we're going to wait. I want to engage with you on the IT. So one of the things that bothered me a lot as an emergency physician, I always worked for big, large hospital chains. And so the EMR, the electronic medical record, is just this big behemoth. It's just unbelievably huge and unwieldy. And it's also absolutely not intuitive for doctors. It's not good for patients. It's not good for doctors. It is good for the billing system. It is good. It captures all the costs. It It enables the doctor to chart in a way that maximizes profit for the hospitals. And I'm assuming the same if you were just in the office setting. But it was very, very frustrating because it wasn't intuitive for the physician. It was very unhelpful for the patient. When a patient would get a copy of their medical record, it was just filled with like pages and pages of basically useful information that was boilerplate. And when there was an inefficiency in the electronic system that would make it very taxing for the doctor's workflow, IT couldn't care less. So it was always important to me that IT and physicians worked hand in glove together to make a system that would work for the doctor-patient relationship. To make such a system, we needed to have clinicians and IT specialists work together. Every other EMR that I've ever seen out there clearly did not have physician input into its being built. So we know, right, Dr. Granberg-Nill, when we onboard a new doctor, it takes them really just minutes to understand. I mean, maybe we spend 30, 45 minutes showing them the whole website, et cetera, but it probably takes 10 minutes or 15 minutes, I think, to learn the system. Would you agree?
I
It's
agree.
very cool. Yeah.
Yes.
So that's new. So thank you for bringing that one up. Thank you. I think you were going to talk about pharmacies next.
Yes, freedom pharmacies. I think it's incredible what we have done to promote people on the outside. Maybe even some of them are still wrapped up in the medical industrial complex or the MIC, but they are truly trapped there in many ways. And the pharmacists are some of those people. But we do have pharmacies. Maybe they're the compounders. Maybe they're the ones that never did the shots or got reimbursed for giving shots. Maybe they are the ones that stood firm and did dispense the ivermectin or the HCQ. At Gold Care, we try to promote our Freedom Pharmacy first. And of course, we have one that drop ships all across the country. And then we have people can always upload or add to their local Freedom Pharmacy. So my Freedom Pharmacy that I like best, I of course have uploaded into Gold Care so that anyone in my area could easily go to that Freedom Pharmacy. The thing that you get when you get a Freedom Pharmacy is, like all of the doctors who work at Gold Care, they have literally been personally vetted. Every one of them, including myself, went through Brian Atkinson, our CMO, Chief Medical Officer, and he was the one that kind of talked us, into this new start with AFLDS and Gold Care. And Brian talked to many broken clinicians. It's really not easy to watch your profession be blown apart in front of your eyes. And that's really what happened. And so the pharmacists, the dietitians, the doctors, and frankly, the members, they're in the same boat. Many of them have just watched medicine be blown apart, and their trust in organizations that they thought would lead them through a crisis has been just blown apart. And so
it's very frustrating. If something goes wrong or a member doesn't understand what's happening or they have a question or a query, how do we manage that at Gold Care?
We truly have an angel at the helm there, and that's Miss Hannah. She is our head of member services, but we have chat capability. They can send a message in through the portal. But we are very responsive to member concerns and member issues. And a lot of that goes back to the PMA, because we want to handle any concern or question before it escalates. And that's just not how it is anymore in the MIC.
And what's really great about that is it's this mutuality. Like there's this relationship between all of the members. Some of us are doctors and some of us are patients. But with the chat feature, with our IT support and with member support, we have given members a voice. So, we both had more than 20 years working in the old system, what we call the medical industrial complex. I know as an ER physician, we were susceptible to, they were called Press-Ganey scores. We just called them internally like popularity scores. Basically, the patient had to like us. If the patient didn't like us, we were in trouble. We were reprimanded, or financial payments were decreased. And for example, this contributed a lot to physicians overprescribing opioids, because a patient would want pain medicines, and if you didn't give them to them, you might get a lower score. It was just crazy how ratings were weaponized against the doctor. But when we started building Gold Care, we both never wanted to weaponize ratings against doctors, but we also want to make sure that the doctors are actually helping our member patients. So how have we done that here at Gold Care?
I think that's really important because members, when they are making an appointment, they want to know that they've selected the clinician that actually will work best for them. They actually do have the opportunity to give feedback, but it doesn't affect the doctor in the way that it is weaponized outside. It is actually used to help refocus the physician if need be. But most of the time, the feedback at Gold Care is very good because the doctors that have made their way to Gold Care, they have core competencies that include character, include competency, and quite frankly, include customer service. So I think that we have found a way at Gold Care to have those ratings and the good intentions that were there in the beginning actually carry through and mean something. They're not put up, they're not made to shame, or they can't be utilized by the member to hurt a doctor if they don't prescribe in the manner in which they want them to prescribe. Again, we're a family, so we will review. If a member says that they had a bad experience, we will actually review that visit video, and we will come down fairly. It doesn't matter. Everyone's a member, and there is no hierarchy.
I love that. One of the most enjoyable things to talk about is our holistic approach at Gold Care. You and I have both MD, medical doctor, after our names, after all the schooling that we did. And that is what most people think of when they think of a doctor. But there are actually a whole lot of other kinds of professionals out there that we were not really exposed to so much in our medical training, but that fall under naturopathic doctor being like the highest. And then there's divisions under them. So in the medical realm, we have physician assistants, we have nurse practitioners, that's all under MD or DO. But then there's this other portion of medical care that's falling under naturopathic medicine. So let's just talk for a moment about, what that's like. I mean, you as a family physician now to have options that you didn't have before.
This one's close to my heart because I have a brother who's a chiropractor, and also Dr. Jana Smith, and I really hit it off when she attended a conference that I was part of right as I was coming out of my old job. I think that Gold Care has a very unique and special characteristic that many others do not have, and that is that all of the allopathic clinicians, myself, any other MD and PA, NP, all of us who are allopathically trained have a genuine respect for those that have been fighting this fight for 20 years. And even more importantly, for our naturopathic friends and such, we aren't going to pretend that we can take a weekend course and hang a shingle and say, well, now I'm a naturopath, or now I'm a functional minded doctor. We have the blessing of being able to work with these people and to refer and collaborate with those clinicians so that our member gets the best outcome. And guess what? The member gets to choose as well. If they come into Gold Care with a UTI, a urinary tract infection, they get to select whether they see our urologist, which, she does a lot of UTI type stuff, or if they see a naturopath first. So we have freedom for everyone, whether it's the member or whether it's the clinician. But our clinicians don't have to feel like they have to do all of this education to become functional or naturopathic trained once they've come awake. We're all a team at Gold Care, and all of our education classes bridge that gap too.
So I want to talk about 2 or 3 more things. There's so much to talk about. One is that one of the ways in that Gold Care is completely different than anything that's come before, the medical industrial complex, is we really believe in the individual and in self-reliance and making the person be the best version of the person who they are. And we have been living really in America in the last decades where people seem to outsource everything, year after year, more and more outsourcing, including outsourcing their thinking. And we've kind of trained Americans to stop thinking critically. And this has really, really hurt us as individuals and as a nation. So it is a huge focus. It's probably the biggest focus of Gold Care is to empower the individual. And so how do you do that? Once in a while you need to talk to a doctor. That's what we've been talking about. And people are concerned about that for sure. But most of the time, people just need solid, good information. And that is actually what we spend most of our energy and time on. And we have, as part of Gold Care, big part of Gold Care is Wellness U, Wellness University. And if you can talk about that for a moment.
I think that is probably the key to Gold Care. We do a fantastic job of equipping our members with information they need. They have access to so many classes. We have currently our master class, I would say, is probably the most popular. The last one I attended this Monday was by Daniel Jones, and he will be leading alternative support type treatments for cancer. It was an incredible talk. And basically, he really incorporated in that talk all that Gold Care will have to offer to people. Now, one of the things that I think people need to realize is we can equip them with the education, but we also want them to know that we have the best clinicians that can help them take that information and devise their own healthcare plan that will work the best for them. Some of the other classes I've attended, Christy Morell's dietitian classes, superb. I learned so much. Even in just one class, I learned what I got in 1 year of med school, which was about 10 minutes. And she was amazing, right? Amazing. The faith classes are my personal favorite. I've attended them for over 2 years. And coming soon, we will have grand rounds where our clinicians will be able to get CME credit, and those will be really special guests. And so for $10 a month, the amount of education that someone gets is just amazing. I forgot one thing, and that's our assurance versus insurance type class. And Eric Baird leads that. And we will be able to help someone basically leave the IIC, Insurance Industrial Complex, and move over out of that, matrix, so to speak. He helped me do it. He helps members do it every day. And I think that Gold Care is there for the heavy lift. You don't get a lot of reimbursement for the heavy lift of education. And we can support DPCs, we can support members on their own with the education that we do. It's
Great.
top.
And that kind of brings me to the last kind of thing, if maybe just for 30 seconds or so. We made a decision at Gold Care that we really want to be online and virtual because we can serve the whole nation this way. And we can offer classes and educational in a way that a doctor in their office really can't. So we want to partner with doctors in the community who are like-minded. In this way, we give them the added support of content expertise in areas that may not be their area of expertise. Also, their own patients, if they're traveling or visiting other areas, they can see anybody in the nation, and we can provide backup for them. A typical DPC or direct primary care doctor is usually working by themselves, and it's kind of a 24/7 job. And if they had peers that they can turn to, Gold Care can be that. So I know that that's also kind of close to your heart, but I just want to emphasize that we welcome working with like-minded doctors in the community, coming alongside, non-competitive, just working collaboratively with them.
Yeah, I think that's really important. I know that when we started, we had thought about doing boots on the ground Gold Care clinics. And now I think that our motto is basically collaborate, don't recreate. We don't want to recreate the wheel. We want to, incentivize and push even our Gold Care members when they absolutely need face-to-face care. We want to make sure that they get infused through the DPCs and the really good individual docs and not back into the MIC. Yeah. They don't want to go there, and we can provide pathways, but that's going to be growing in the next year for sure.
Great. So I just want to welcome everybody to check out goldcare.com. It's really a new way forward. There's a huge emphasis on empowering you through education, things that you just need to know. We have so many classes that are taught by just incredible people, medical doctors like myself and Dr. Granberg-Nill, and also classes taught by other specialties like dietitian or spiritual leaders or naturopathic doctors, just a wide array. We have classes on deprescribing, learning how to get off prescription medicines whenever possible, classes in spirituality, classes on how to get off the insurance industry. If you are ready for that, I've been off insurance for more than 10 years. There's a safe way to do that that's responsible to your family and your obligations. And just to invite doctors who are like-minded in their community, who want to find other like-minded physicians who can come alongside them and provide additional educational resources. And for members, you get much more freedom. You get privacy and security. You get convenience of talking to doctors and other providers in the comfort of your home, really, making appointments anytime you like. You have a lot of input into the quality of the care that you receive. If you're having a negative experience, or which we've never had, but if you have any kind of question about your experience with your doctor, we're super responsive to that. We want to hear from you. And just that we've built a brand new system from the ground up so that you won't be bothered with extraneous, heavy weight that doesn't do you any good. So we're here for you at goldcare.com. Dr. Granberg-Nill, an experienced family physician of more than 20 years, she jumped ship just like I did from the ER. She jumped ship from private practice, into this brave new world that's looking so much better than the old one. And you can see for yourself how passionate she is on the subject. So Dr. Granberg-Nill, if you'd like to close us out with just maybe welcoming people to Gold Care, or any other thoughts?
I love our website, goldcare.com, and it says, "Welcome to the healthcare revolution." And that is what we are truly trying to do. We're not trying to repair, slap a Band-Aid on medicine. We are trying to revolutionize it and bring what the profession was meant to be to patients. And I think that one of the ways that we do that is we focus on wellness, and we are doing just that. So we would love to have you check us out.
Love it. Thank you so much for your time today. Thank you.
Thank you.
Thanks for joining me on the Gold Report, where we inspire you to be 10% more courageous in your daily life. Please like, share, and subscribe so you never miss an episode. See you next time.